Well, Pearl, happy Thursday to you, and thanks for taking some time out of your day. It's great to be reconnected with you. I think about you and many Canadians this week. While you're not in Nova Scotia, you're close enough to feel the additional burden that the weekend's shooting has brought during the time of the pandemic. So I've been thinking a lot about my Canadian friends. And, when I think about what this pandemic has done, it has really reshaped many of the things in civil society that most of us, thought were previously unimaginable. So when you think about the most far-reaching changes that might happen in philanthropy, what should we as leaders be considering now from your perspective?
So first of all, Gary, thank you for acknowledging that certainly the country is feeling the impact of that horrific tragedy. I have to say that as we focused on learning more about the individuals who lost their lives, there is a central message that actually aligns very nicely with what we're finding in our work, and that is the incredible sense of compassion and empathy and caring for individuals. And while those individuals who lost their lives were not necessarily as vulnerable as many people are today in both of our countries as a result of the pandemic, there seems to be that central essence of caring and kindness and the we to we, and what might we do in service of supporting each other. So thank you for remembering our fellow Canadians in Nova Scotia. When I think about the changes to philanthropy, and I think everything as starting all over again. And I keep taking myself back to the way we are organized as a healthcare foundation. I think about it in the context of staff, processes, governance, the relationships with donors, and there isn't any element or aspect of our work that has not changed and will not change. And so I begin to think about words such as where to begin. And the first place, I guess, is on the case for support. And the case for support for philanthropy, I think there are some wonderful opportunities where we're going to see an acceleration of something that you and I have talked about a lot. And that is that higher mission of serving community and stepping out of the traditional things that we think about, particularly in healthcare, raising funds for equipment and facilities and science and new programs and so on and so forth. So I think that a gift of all of this is really an acceleration of that more holistic case for support, which will probably lead to a faster way in which organizations like mine partner and collaborate within community, truly focused and centered on the determinants of health, which includes more than the typical mission of our organization. And the work that you and I have done, and you've helped us to shape our 30-year vision, is really centered on that whole notion of healthy communities and well-being in its fullest form. So I see that accelerating, and I see the case for support changing quite dramatically. What I do think about, though, is at the end of the day, the hospital will still require us to raise funds for the traditional things that we have been raising funds for. So another thing that's going to change is, how do we define success? How do we measure success? How do we do both? And how do we make those connections between supporting research, supporting healthcare programs, in support of health and well-being within the organization? So I think about a whole new way of managing expectations for the multiple stakeholders that we have, and where and how do you actually place them in any ordered sense of priorities? And is that an impossible dream? Or is this around, what are we going to do in terms of shaping our programs and the people who help us to raise funds and to garner that philanthropy, looking in a way that is actually more donor-centered and personalized than we can possibly imagine. And I also see that organizations like mine have been thinking about using technology and fundraising in the virtual world, and trying to obviously meet donors where they are and whichever platform they're on. And just reflecting back on the last month, I just think that the hyper storytelling, the why that we are doing what we're doing, whether it's addressing food insecurity, whether it's raising funds for COVID research, it really has galvanized both those of us that are raising funds and those that have the ability to support, to really come together in ways that I think we have not thought about before. So the central issue for me in that context is, how are we going to leverage technology, and how we're actually going to think about relationship development and deepening relationships in an entirely different way. And it's so hard to imagine. We're so wired to sitting across a table, a living room table, sitting across a dining room table, sitting in a boardroom, having a PowerPoint presentation, having a proposal. All of the things that have been in our toolkit, I think has changed, or is going to change dramatically. And that impacts the way we're organized, the people we bring on our teams, the skill sets that are needed. And then governance is going to be really, really interesting. And you know, I think today, when I think about a typical matrix that we would have as an organization in terms of thinking of a board composition, some of those will still be needed, the kinds of skill sets, the way we think about the expertise that we need. But I keep thinking I probably need multiple think tanks and people who can gather around a table and help us to navigate through how the organization has changed, how we have to upskill, how we have to relate to our donor community, and how we have to reconfigure what we've known traditionally as a comprehensive development program. And you know, today in our local newspaper and our national newspaper, an organization talked about 2 events that were multi-million-dollar net gala type events. They were able to actually raise those dollars without having an actual gala. So, you know, that also changes how we bring people into the organization, and how we relate to them, and we design programs for them. So I see it as everything turned upside down. And when I think of certain paradigms, like the donor pyramid, or I think about how we define donor centered, there are some principles that are rock bed, but there are others, I think there's no playbook for it. And we're going to have to experiment, and we're going to have to communicate further. And we're going to have to meet people in a very, very different way than we have. And, you know, as I think about it in terms of what's going to be the impact of the current economy, and how quickly will there be recovery or not. And if it's a 2-year horizon, then how many of these scenarios would we need to be in at any one given time, innovating? How many of those scenarios will we need? What will those scenarios look like? So I think there's no simple answer to your rather pointed question, which is what will most change? Because I do feel that it's just a big swirl. It's a swirl.
Yeah.
And navigating through that swirl will really just require a lot of deep conversation, but you got to get to action. So how do you marry those two? You know, before we started this formal discussion, you were talking about making decisions, don't looking for perfection. Is 80% good of problem solving? Is 90%? You know, what is it? But it's that desire to consider what needs to be done, set a plan, be informed with some good criteria to back it up, and you need to move. You need to move and innovate again, learn, fail forward and learn, and continue to redesign. So, you know, you're familiar with our leadership framework, and I would say that generativity in terms of discussion and wired for a sense of redesigning are two things that we're going to need to bring forward to the leadership team and to the board table a lot more. So I'm going to stop there because you know, I think those are the things that I'm thinking about. And anchored with all of that is actually trying to think about what's the value proposition and what will be the value proposition for some of our donors, whether they're individuals, whether they're large corporations whose businesses are changing so significantly. What would be the value proposition in a virtual world? Are we going to be able to do our entire work on our phones? And what does that mean for people like myself and my team, where the greatest joy is that one-on-one conversation with an individual who's inspired for mission?
And I just want to reach through the screen and hug you, Pearl, because when I thought about this conversation, I thought about, well, what's the scope of the questions that should be asked right now? And you've raised numerous ones. What I'm hearing you say is we are probably coming back to those immutable bedrock values that will not change, but everything else is being reimagined. And it could very well be that the connections that we have, the social connections, the intentional connections that we have with people actually become deeper and more sought after because we no longer take them for granted as being routine. You said to me before we started something like, maybe at this moment it's more important that we sit with the right questions then we try to pursue an immediate action-oriented answer. So you've helped to frame so many of those good questions for them today, and for that, and just for you, I'm deeply grateful. Thank you, Pearl.
Thank you, Gary.
Stay well.